Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Medical Laboratory Science Council of Nigeria seals off some laboratories for operating below minimum standards. Arrest 2 in Ogun State. Edo State embarked on massive campaign to draw residents out for second COVID-19 jabs. And coronavirus hotspots in Germany gets tough on the unvaccinated as cases rise. We begin with activities in Scotland as more than 25,000 delegates are attending the UN climate talks COP26, one of the first major global gatherings to be held during the pandemic. And organizers have implemented a raft of antivirus measures, including daily testing, mask-wearing requirements. According to the organizers, the safety and security of everyone at COP26 and in the surrounding community is of utmost importance. It's urging delegates to avoid hugs and offering guidance on how to recycle wet wipe packaging. Delegates at the Glasgow talks also have to take a self-administered lateral flow test each day and record the results on a UK National Health Service, the NHS app, before entering the blue zone where the negotiations are being held. Meanwhile, in Africa, over 7.9 million recoveries have been registered on the continent. According to the Nigeria Center for Disease Control, 186 people recovered. They were discharged last night. The agency also reported 99 new confirmed cases of COVID-19 and 1 death. Here's more on the virus update.
99 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 9 states and the FCT and indicate a rise from the figures reported 24 hours earlier. Bauchi and Plateau states are in the lead with 24 cases each, while the FCT had 22 cases. Lagos had 9 cases, Taraba reported 8, Kaduna registered 4 cases, 3 cases were reported in both Edo and Kano states. Bayelsa and Rivers came in with 1 infection each. No cases were reported in 3 states, Delta, Sokoto and Zamfara, and the total caseload in Nigeria has risen to 212,150. 186 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 203,524. There was 1 additional death from COVID-19 complications reported in the last 24 hours, raising the total number to 2,899. Currently, there are 5,600 active cases in Nigeria, while over 3.3 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that more than 5.7 million Nigerians have received the first shot of a COVID-19 vaccine, while over 3 million persons have been fully vaccinated. Globally, more than 7 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 218,000 deaths recorded across countries on the continent. More than 247 million people all over the world have contracted COVID-19, while deaths are over 5 million.
The Medical Laboratory Science Council of Nigeria says that some medical labs in Ogun State have been sealed, while 2 arrests have been made for compromising safety and operating below minimum standards to guarantee quality of medical laboratory results. Briefing journalists on the development at the State Ministry of Health in Abeokuta, the Deputy Registrar Inspection, Lorena Okoro, said the measures were inevitable to ensure safety of life and of the residents, while assuring the resolve of the Council towards re-engineering its inspection process in line with international best practices. She, however, appeals to practitioners to key into this new policy direction for quality management.
While it is commendable to note that some medical laboratories in Ogun State are operating slightly above average, the MLSCN inspection team noted that many others are operating below the minimum standard, required to guarantee quality medical laboratory results. Furthermore, we also noted the use of unqualified medical laboratory personnel to generate laboratory test results by some facilities, while others operate under unacceptable facilities that compromise quality, as well as staff and patient safety. Also, most of the qualified medical laboratory scientists and medical laboratory technicians do not have correct practicing licenses and work permits, respectively. Therefore, the MLSCN cannot guarantee the accuracy of the test results they generate. It's very important that they have current practicing license, because that is evidence that they have done mandatory continuous professional development in the previous year to enable them to continue to practice. So that may suggest that some of these people are moribund in their practices. They are no longer allowed by law to practice. That's why we are bringing that to the attention of the public. Also, most of the qualified, also, over 95% of the inspected medical laboratories in Ogun State do not participate in external quality assurance scheme. This also casts shadows on the quality of test results they produce. External quality assurance is very important to ensure that the processes are appropriately controlled, to ensure that the accuracy and precision of the test results from such laboratories are guaranteed. When you have over 95% operating without carrying out this test, it's actually a source of grave concern to us.
And to Edo State, where the government says it is making progress in the COVID-19 vaccination drive, but advises those yet to be vaccinated to take advantage of the opportunity the government has provided. The special advisor to the Edo State governor on media and communication strategy said in an interview with Channels Television, he encouraged residents and visitors to continue observing other preventive measures, including the use of the face masks, physical distancing, and hand washing.
The massive push for the campaign is slowing down because we had a target date for delivering first doses and then second doses to citizens in the state, and we essentially caught up with those targets. Over 150,000 people, have received at least one dose of the vaccine. I repeat that over 150,000 people have received at least one dose of the vaccines. And what we're doing now is we're doing a massive telephone, outreach to everybody who has received one dose to come and take their second dose. We have a command and control center in Government House in Benin City where we call every single person who has taken one dose of the vaccine to come and take the second dose. And at the EOC, the delivery of the vaccines is ongoing. But if you notice, the recorded cases and so on and so forth is beginning to taper, beginning to dip, and so that has also affected the way we carry out enforcement. Not that we have stopped enforcing, but we have simmered down a bit, but we still encourage citizens to continue to use the safety protocol, face masks, wash their hands thoroughly, and so on and so forth, and maintain safe distance anytime they're in crowded places. We believe that the vaccines, they are the silver bullet to deal with this challenge, and we continue to emphasize and we continue to encourage our citizens to get vaccinated and get protected. Because yes, the third wave is over, but we know that the fourth wave will come and maybe a fifth. So why not just protect yourself by taking the vaccine and reduce the risk of either getting seriously ill or dying from the disease.
Well, still on vaccination, a new study has shown that COVID-19 vaccine hesitancy is high among staff and students of the Nigerian university. The report shows significant influence of many things, factors, age, denominations, several other affiliations. The study was done at the Nnamdi Azikiwe University, a close-knit community with large staff and student population located in Awka. It also has a large population of stakeholders who come into the university frequently. To talk more about this study, joining us is Professor Ekemefuna Uzochukwu, a professor of medicinal chemistry, director of research and innovations at the university. Thank you so much for joining us on the program. Tell us, how damaging is this report to the vaccination efforts in the country?
Thank you and good evening. Our study and our report is not damaging to vaccination efforts. It actually adds to the data, evidence available within Nigeria to help drive vaccination in Nigeria. You know, because if you don't know where your problem is coming from, then you may be actually pursuing the wrong target. So now we have data, we now have evidence showing exactly what is happening in a university community. And that can inform policy directions, it can inform decisions, it can inform strategy, both at the national level, at the state level, and even within communities. Thank you.
Particular data, what does it say, and what were the parameters briefly used in arriving at the conclusion?
Okay, so when we did this study January, February 2021, that was before the vaccination was rolled out. You know, the vaccination came in March 2021 and we are rolled out. So we wanted to find out how willing are members of the university community, how willing are they to accept these vaccines? If they are not willing, what are the reasons? What are the factors behind this? So that was the study we basically did. And by the time the results started coming in, we saw that only a fraction, about 34% of our people are willing to accept these vaccines, COVID-19 vaccine, you know, and as much as 65% are hesitant to accept this vaccine, which is quite high for a university community, you know, especially when you look at the fact that the Honorable Minister for Health talked about 50% acceptance rate sometime in March 2021. The acceptance rate for vaccination in Nigeria was about 50%, according to the minister. Now, in a university community, we are seeing something as high as 65%, which is really a cause for concern.
Now, looking at still those findings, and you said this was pre the vaccination, Prof, do you think that perhaps that study might change, seeing all the efforts government has put into the drive to sensitizing on the need to vaccinate against COVID-19?
Yeah, attitude to vaccination actually is a moving target. It's something that is not static. Before our study, there was another study in Nigeria that placed it at 25%. That's hesitancy, 25%. That was in 2020. Now we're talking about early 2021. We are having about 65% hesitancy. Now, what could be responsible? Because just before the vaccine came out, or as soon as the vaccine came out, there were a lot of conspiracy theories circulating. So a lot of things have changed. And when the vaccine came in, they were being used. So these figures cannot be said to be static. They're actually moving. So if we do the right things, the hesitancy should drop. If we fail to do the right things, the hesitancy may actually be increasing. Thank you.
Thank you so much. We appreciate your time coming to talk about this study. Wish you all the best in your further research on this issue. Thank you. We've been talking to Professor Ekemefuna Uzochukwu, a professor of medicinal chemistry, director of research innovations at the Nnamdi Azikiwe University, Awka. Thanks so much for joining us.
Thank you.
We have more on the global outlook to the COVID-19 pandemic. Please stay with us. And physicians in Yobe State have asked journalists to take the COVID-19 campaign to the doorsteps of the general public to minimize fatality associated with the disease across the country and also the long-term effects. This was disclosed by the team of volunteers while carrying out medical outreach to journalists at the ongoing media games organized by the Nigeria Union of Journalists, Damaturu, the state capital. According to them, journalists have speed and multiple tools of communication that can help sensitize the general public on preventive measures against the virus.
We applaud the journalists and every writers association for the awareness they are creating for the public to know the etiology, the cause, the pathogenesis of the COVID-19. Because COVID-19 has a lot of pathogenesis and pathology that can have a long-term effect on the body. If everybody has come across any journalist creating awareness, let him appreciate and let him accept everything the journalist has said to him and appreciate everything that the journalists and NUJ they are doing. When something is innovated in the first time, there will be a controversy on it, on every aspect of this thing. When polio vaccine was invented, there are some people said polio vaccine can cause someone to have hemiplegia, that is loss sensation of the left side of the body, but that's all untrue. But for COVID-19 vaccine, you can have some side effect, which is a short-term effect, but it has a long-term advantage over the short-term effect of the COVID vaccine.
Away from Nigeria, despite movements throughout the country talking about South Africa during the political party campaigns for local government elections, the country continues to record low COVID-19 infections. Data records that shows that 169 new cases were recorded in South Africa. Laboratory confirmed cases now stands at over 2.9 million. The 7-day average is 1.3%, and the 7-day moving average daily number of cases is said to have decreased. The majority of new cases are from Gauteng province, followed by Free State and KwaZulu-Natal at 17% each. According to the Department of Health, the increase represents a 0.8% positivity rate. In the meantime, the country is also vaccinating adolescents. Well, joining us to talk more about the country's next plans in vaccination is Professor Lekon Ayo Yusuf, who is the DVC Researcher, Valgo Magatho, Medical Sciences University of Pretoria. He joins us via Zoom. Thank you for joining us on the program.
Thank you for having me.
Now, Prof. Ayo Yusuf, South Africa joined the likes of France, Canada, Germany to offer vaccinations of COVID-19 to teens. And this is months ago. How is that progressing?
Yeah, there is a significant uptake, but as you can imagine, it's a function of the parents themselves allowing the kids to be vaccinated. We've had part of the trial in our university, and we had quite a lot of subscription to that. Initially, there was a lot of hesitation because obviously lack of knowledge. But subsequently, I think the teenagers have taken it on as a group. In fact, you know, my son inclusive, they've all got excited to get vaccinated.
So, and that's with adolescents and teens, but I'm going to come back to perhaps lower kids now, age range perhaps below 12. But according to research, adolescents are less likely to suffer the severe effects of the virus. So are we vaccinating them for themselves or from essentially becoming a reservoir for the virus as the adult populations are getting immunized?
Right, yeah, it's true that the risk for infection or hospitalization is much lower for younger people, but it's not zero. And I think that's the key and important part. So to the extent that, particularly in African population and specifically South Africa, you tend to have older people who look after younger people. So there's usually that generational gap. The parents will go work in the city and leave the young ones with the grandparents. So no one is safe until everyone is safe is the principle. So no matter how small the reservoir is, the fact that they're staying with older people means that you would only get a better effect at a population level if everyone gets vaccinated.
Lower children, and that's below the ages of 7, and also the 1 dose for the Pfizer-BioNTech vaccine. What is advising that, especially with, you know, what other countries are doing in terms of vaccinating that population?
No, 1 dose is enough for young ones because it's not a function of how many doses. It's a function of how much immunity you're able to get from the vaccine. So the typical dose that goes up to 80 microgram for adults might create too much a reaction, because younger people, obviously, they have a different metabolism in terms of converting the vaccine, and they also have a different immunogenic response. They tend to have very active immunogenic response because, obviously, as you can imagine, when they're young, they get to be activated by eating things on the floor. So they tend to have a very strong reaction. So if you give them too much, obviously, you could cause more problems. So one dose has been found to be good enough to give immunity to those kids.
And do you think that the expansion of the vaccines will get to children as young as 3 in South Africa?
Yes, as soon as, obviously, the safety issue, like I said, it's a real balance between safety and getting an effective vaccine. But at this stage, to the extent that there is enough vaccine to go through the adults, which is the priority, it's not likely that we will get to that age in any time soon.
Let's talk about the vaccines themselves, which are being given. I know some scientists don't like to talk about this, but in some places, some countries, there appears to be preference for particular vaccines. Take the Pfizer one, for example. What would you say is the case in South Africa?
In South Africa, there's been studies that have looked at these vaccines. They have different modes of action, but all in all, the effectiveness are at the level that it does not really matter which one you take at this stage. So yes, there is a lot of discussion around preference for what I would say, obviously, for convenience, a single dose in a rural setting where people would have to look for money to go for a second dose is much easier to use than a double dose regimen. So other than that, in terms of its efficacy, they're pretty much good enough for the population.
Finally, I mean, great news that the numbers are decreasing. And how would you say the country is battling this? Is it that people are really listening to all the measures in place, the NPIs, or a lot more people are vaccinating, or is taking all of that, you know, to make this work?
It's a multiplicity of things. Currently, about 1 in 4 adults have been vaccinated, at least 1 or 2 doses, which is quite significant if you consider that South Africa was severely affected in the first and the second and third wave, which means that might also be already people who have responded or have developed immunity. If you combine that with the number of people vaccinated, I think we pretty much a combination of getting closer to herd immunity of some sort and adherence to the MPIs. But I think it's more likely that we're getting closer to herd immunity than we thought we would get to.
And that is great news for South Africa and the world. We'd like to thank you, Professor Lekong Ayo-Yusuf, DVC Research, Sefago Magasso, Medical Sciences University, Pretoria. Thanks for joining us on the program.
Thank you for having me.
And Germany's health minister has called for booster vaccinations to be stepped up and for more frequent checks of people's vaccination or test status as new COVID-19 infections increase. Senior health officials also appealed to German residents who haven't yet been vaccinated at all to get their shots, though the health ministers acknowledged that many of the holdouts can't be convinced. Here's more on the Global Update.
Global Update begins in Germany, where COVID-19 hotspots are getting tough on unvaccinated people as the number of cases rises. Local county commissioner for the town of Modeldorf says it's either people get vaccinated, which is how people can protect themselves against the virus and to protect people around them, or people could reduce their contact with those who have not been vaccinated. He admitted that the region never really managed to lower the case number as much as other counties and regions because of the town's vicinity to the Austrian border and the return of a lot of Eastern Europeans. Over in Ukraine, several hundred people blocked traffic in the center of the capital, Kyiv, in a protest against coronavirus restrictions and compulsory vaccinations, which the government introduced to curb new infections. Ukraine has registered record high rates of new cases and deaths from the coronavirus in recent weeks, and its total number of infections almost reaching 3 million, with 69,447 deaths. Vaccines have become compulsory for some state workers, and in red zones, including Kyiv, only vaccinated people or those with negative COVID-19 test results are allowed into restaurants, gyms, and on public transport. China's top epidemiologist has called for closer international vaccine cooperation against the coronavirus pandemic and criticized some countries for politicizing vaccines to hinder global anti-pandemic efforts. The director of the National Clinical Research Center for Respiratory Disease made the comment in an interview in China. He said the international community should enter into such cooperation as it does in addressing other pressing challenges. Finally, leader of a remote community in Peru's Amazon rainforest says he first heard about the global pandemic when health workers arrived by boat to his isolated village with vaccines last month. Mangual is the village highest up the river. Residents have no electricity in their wooden stilt houses, living from hunting and fishing. Connection with the outside world is minimal, and the local language developed over centuries of isolation. Many people in the community complain they really need better continuous healthcare services.
Vaccines alone are not enough to keep the pandemic away. Adherence to all the non-pharmaceutical preventive measures are also needed. Continue to take responsibility. You can take a look at our websites for the latest, a better understanding of the pandemic. It's channelstv.com. And that's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.